Okay.
Good morning. How are you today?
I'm good.
All right. I'm just going to provide privacy for us. And can I get your name and date of birth?
Abigail Stolfer, 33003.
Okay, that does match your wristband. Now, while I'm washing my hands, I just want to inform you that everything we say and do today is confidential, and you have the right to defer anything if you wish. All right. So, just once again, can you confirm your name for me?
Abigail Stolfer.
And what room are we in right now?
We are
Or what building?
Martin.
Yes. And what year is it?
2023.
Okay. Patient is awake, alert, and oriented ×3. So, can you bring your finger out for me and just back to your nose? Can you smile for me? All right. Patient follows verbal commands well, and patient's speech is appropriate for their age. So, I'm just going to look at your eyes. All right. Let's see. Pupils are a 4 bilaterally. All right. And I'm going to dim the lights, and I'm just going to shine this in both eyes real quick. All right. Eyes equally constricted with light. Now I'm just going to have you look at Madison over here. Right, and then look back at my pen. All right, eyes equally converged. Now we're going to go out here to the Snellen chart.
Okay.
Do you have any contacts in?
I do not.
All right. Let's do this. Okay. All right, so I'm just going to have you stand right here, 20 feet away from the chart. And with both eyes, I'm just going to have you start at the 4.
LPED,
All right. 5,
PECFD,
6,
EDFCZP,
7.
FELOPZD.
And can you read 8? And now can you cover your left eye for me? All right. Patient has 20/25 vision in both eyes. Now can you cover your right eye for me? And with your left eye, start at 4,
LPED,
5,
PECFD,
6,
EDFCZP,
7,
FELOPZD,
8.
DEFPOT. I can't see the last name.
Okay, patient has 20/25 vision in the left eye. Now just cover your cover your left eye for me. And with your right eye, start at 4,
LPED,
5,
PECFD,
6,
EDFCZP,
7.
FELOPZD.
And can you read 8?
I can.
Okay. Patient has 20/25 vision in the right, left, and both eyes. So next, I'm just going to take a look at your ears. All right. Patient's ears are symmetrical bilaterally. Patient's ears are in line with the outer canthus of the eye bilaterally. And patient has no lumps, lesions, or wounds on the external surface of the ear. You do have one piercing on each ear. All right, next I'm going to take a look at your nose. Your nose is symmetrical bilaterally. I don't notice any lumps, wounds, or lesions on the external surface. The patient does have several freckles around the nose. I am going to inspect your turbinates.
I'm sorry. Only 4 minutes.
All right, turbinates are present. Now I am going to have to take a look in your mouth. Is that okay?
That's fine.
All right. Patient's buccal mucosa is moist and pink. Tongue is midline and pink as well. Teeth are intact, look clean, no caries. Patient's gums are intact, no signs of gingivitis. Now, would you stick out your tongue for me and say ah?
Ah.
Okay. Uvula rose with phonation. And do you have tonsils?
I do not.
All right, let me take one more look. Yeah, tonsils are absent. Let's see what else. I do need to test your gag reflex. You do have the right to defer this.
I defer.
All right. Well, if I were to do this, I would ask the patient to stick out her tongue, and I would put a tongue depressor on her tongue and test her gag reflex that way. All right. Now I'm going to just inspect your neck. I don't see any lumps, lesions, or wounds on the neck. The neck is symmetrical. The trachea is midline. Patient has several small freckles on the neck. We're going to inspect for pulsations. Pulsations are not visible, but that is okay. Now I'm just going to palpate your carotid pulses. All right, this one separately. Carotid pulses are 2+ bilaterally. Now I'm just gonna listen for any bruise, if that's all right.
Good with me.
Okay. I'm gonna listen with my bell and just hold your breath for me. Okay. You can let out. One more time. Hold your breath. No bruises are present on either side of the carotid arteries. Now, I'm just going to ask you to sit in this chair, if that's all right. And I'm going to inspect your back. All right. Patient's back is symmetrical bilaterally. Patient does have adequate rise and fall of the back. I do see several small moles, some freckles on the back, which is perfectly fine. Now I'm going to palpate for tenderness, if that's all right with you. Just tell me if you feel any pain.
Okay.
Any pain?
No pain.
Patient notes no pain or no tenderness upon palpation. Now I am going to auscultate for your breath sounds. So I'm going to start up here at the apices and just go down in a little zigzag pattern. Just breathe in and out for me. Okay, last one. Patient's breath sounds are regular and unlabored. Now I am going to percuss for CVA tenderness over your kidneys. So just tell me if you feel any pain or anything uncomfortable.
No.
Okay.
No.
No? Patient notes no CVA tenderness. All right, you can sit back on the bed for me. Now, I'm just going to take a look at your chest, okay? Patient has no lesions, lumps, or wounds on the anterior chest. Several small freckles are present. Patient does have adequate rise and fall of the anterior chest. Now, patient's respirations do seem to be unlabored, but I am going to listen to them. Okay. All right. Patient has 14 breaths per minute. Now, I did your anterior chest. Now I'm going to ask you, I'm going to do your heart sounds now. So, I'm going to start in your aortic with the bell. Regular rate and rhythm, S1, S2 present, no murmurs on the aortic. Regular rate and rhythm, S1, S2 present, no murmurs on the pulmonic. Now I am going to have to, right here. Okay. Regular rate and rhythm, S1, S2 present. No murmurs on the tricuspid. Now, if you could just lay down for me.
Okay.
I am going to do your mitral. Okay. Gonna go up a little bit.
That's fine.
All right. Regular rate and rhythm. S1, S2 present. No murmurs on the mitral valve. Now I am just going to palpate that once more. Your apical. All right, I would give that a 2+. Now I am going to auscultate your apical pulse and count your beats per minute. All right, you are at 64 beats per minute. Now I'm just going to flip to the bell of my stethoscope, do the same thing, and listen for any bruits. Okay. No bruits on the mitral valve. No bruits on the tricuspid valve. Right there. No bruits on the aortic valve. I mean, that was the pulmonic valve. And no bruise present on the aortic valve. All right, you can go ahead and sit up for me. I am going to take a look at your upper extremities.
Okay.
I don't see any lumps, lesions, or wounds on the upper extremities. Patient does have an adequate amount of freckles on the arms. There is adequate hair distribution on the arms as well. Now I am going to do some strength testing with you with your arms. So if you could just hold your arms up like this for me and pull towards yourself. All right, push towards me. Patient has 5 out of 5 strength in the arms. All right, now I'm going to do your shoulders. Just push up for me against my resistance. All right, patient has adequate strength in the shoulders, 5 out of 5. All right, now your grip strength. So just hold my hands like this and pull them, all right? And then I'm gonna have you hold your hand like that and then spread your fingers out against my resistance. All right, patient has adequate strength, 5 out of 5 in the fingers, the arms, and the shoulders. In the hands, arms, and shoulders. All right, now we're just gonna do some range of motion. So just do this with your fingers, flex them, extend. All right, now for your wrists, just go in, like this, out, up, down, good job. All right, now for your arms, or for your elbows, just bring them up, back down. All right, and for your shoulders, you might have to stand up for this one. Just extend, go backwards, all right, and then up like this, down. All right, patient has adequate range of motion in all the upper extremities. All right, now I'm just gonna take a look at your abdomen if that's all right.
Okay.
So you can just lay back down for me.
Take my clip out.
All right. The patient's abdomen does have adequate contour for her ethnicity. The abdomen is symmetrical bilaterally. When I did her upper extremities, I also would do her pulses, so I can do that right now. All right, I'm gonna get your radial pulse. All right, radial pulse is a 2+. Now I'm just gonna get your brachial. All right, brachial pulse is a 2+ bilaterally. Radial pulse is a 2+ bilaterally as well. Now I am going to do your capillary refill too. You can just stay laying down for this. All right, patient has capillary refill of less than 2 seconds on both hands bilaterally. All right, we can get back to your abdomen.
All right.
All right, abdomen is symmetrical on both sides. Patient does have adequate contour for her ethnicity. Umbilicus is midline, inverted with no hernia. I don't see any lumps, lesions, or wounds on the abdomen. I am just going to inspect her pulsations real quick. No pulsations are visible, but that's all right. Now I am just going to auscultate for vowel sounds. I'm going to start in your right lower quadrant.
Okay.
Okay. Vowel sounds are normoactive. Now I am just going to palpate for any tenderness. I'm doing light palpation. Okay. All right. I don't note any masses present. Do you feel any tenderness?
No tenderness.
All right. Now I'm just going to do some deep palpation.
Okay.
Won't hurt. Okay. All right. No mass is noted. Do you feel any tenderness there either? All right. All right. Now I'm just going to get you to sit back up for me. And okay, so I do need to palpate your femoral pulse, but you do have the right to defer this.
I defer.
All right. Well, if I were to do this, I would just palpate on the inner groin area, and I would grade it as well on the femoral pulse. All right. So now I'm just going to have a look at your lower extremities, your legs. Hair distribution is absent. Do you shave your legs?
I do.
All right. That would be normal then. No varicose veins are present. What else? I am going to test for edema. Alright. No edema is present. If edema was present, I would grade this. Now I am going to just seeing how warm your skin is. Skin is warm to touch, so that's good. Let's see. Now I'm just going to look at your toes. In between them. All right. Let's see. Toes look clean. Okay, now under your feet for me. I'm sorry. All right. Skin is intact with no calluses present. Now you can go ahead and wiggle your toes around for me. Flex them, extend them. All right. Patient has adequate range of motion in the toes. Now for your ankles for me, just bring them or invert them. So like do like this, right? Patient has adequate range of motion in the ankles as well. Now, for your knees, you might have to stand up. I just want you to go like this. All right, the other leg, patient has adequate range of motion in the knees as well. Now, you probably will have to lay down for this one. I'm going to get your hips.
Okay.
So, with your right leg, just bring it straight out for me. Right, back, other leg, out and in. And then you can bring your right leg up towards you. Back down, up towards you, back down. All right. And then for internal rotation, you just bring your leg in and then out. Same with the other leg. In and out. All right. Good job. Patient has adequate range of motion in all of the lower extremities. Now, I am going to test some strength in your lower extremities. So just push against my resistance. You can pull back towards yourself. All right. Patient has 5 out of 5 strength in the lower legs. And for your feet, you can just push up, push back down. All right. Now, patient has 5 out of 5 strength in the feet as well. Now, if I were to do capillary refill, I would just press down and it would be normal for the patient to have a capillary refill of less than 2 seconds. But since she has on nail polish, I'm not going to do that today. Is that all right?
That's okay.
Okay. Now, I did range of motion. I did strength. I inspected. Now I'm going to do your pulses.
Okay.
All right. So starting at your popliteal. Okay. Popliteal pulses are 2+ bilaterally. Now for your posterior tibial. Just going to get right here behind your ankle. Posterior tibial pulses are a 2+ bilaterally. Now you can just rest your feet on the ground for this. I'm going to get your dorsalis pedis. Let's see. There. Dorsalis pedis is a 2+ bilaterally. Let's see. I think that's it for your lower extremities. All right. So I am gonna do your range of motion in your spine, if that's all right. So just do like this,
Oh
this,
God. Is that rough?
and then you can go back, and then back down. All right. And I don't know if I did range of motion in your shoulders, so we're gonna do it again.
Okay.
So up, down, and then up, back down again. Okay, now I am going to test for scoliosis.
Okay.
So if you just turn it around for me, bend down. All right, spine is midline. I don't see any rib humps present. Spine is midline, is straight line. No rib humps are present. All right, you are negative for scoliosis. And I did evaluate her gait on the way to the Snellen chart, and her walk was steady. Right.
That's it. I think